Hello everybody, my name is Luis Leiva and today I will be explaining swallowing, or in a fancy word, deglutition. Deglutition is a complex process that I'm going to explain in details and in an easy way so you guys can understand it and have a better comprehension of deglutition. It's just not swallowing, but it takes a whole process, complex process that I'm going to explain today. Swallowing, it's a complex process, as I mentioned before, initiated voluntarily, but it proceeds automatically once it begins, meaning once we start putting something in our mouth. First, we insert food to our mouth and start mastication using our teeth to grind our food.
Are you ready? Open your mouth wide, put food inside. Saliva glands secrete as the teeth starts to grind. Chew, chew, chew.
Through the pharynx to the esophagus, propelling food to your stomach.
Are you ready? Open your mouth wide, put food inside. Saliva glands secrete as the teeth starts to grind. Chew, chew, chew.
Through the pharynx to the esophagus, propelling food to your stomach.
Are you ready? Open your mouth wide, put food inside.
After we chew, then the swallowing reflex begins, when the tactile receptors on the hard palate and the soft palate arches of the uvula are stimulated by passage of bolus or pizza. In this case, there were crackers. When the palatal arches and the uvula are stimulated, this stimulation is transmitted to the swallowing center of the medulla oblongata by two nerves, the trigeminal nerve and the glossopharyngeal nerves. Motor commands from the medulla oblongata then signal the pharyngeal muscles to contract and make a stereotype patterns of the muscle contraction. It takes about less than a second for the pharyngeal muscles to move the bolus into the esophagus. During this period, the respiratory system stops in order to allow food to pass the right track. Each day we swallow approximately 2,400 times. There are three phases. The first phase is voluntary, which, as mentioned before, it's called buccal phase. It's when you push food to the back of the throat, back of the oropharynx, the bolus of food. The tongue pushes it back and pushes the bolus of food against the hard palate and the soft palate. Then you seal off the nasopharynx. Eventually, the food is back and it's going to start pharyngeal phase. The pharyngeal phase will push the uvula and it will close the epiglottis. We don't want the epiglottis open when we swallow because food will go down the trachea or windpipe. This is called inspirated. We can make this happen when we laugh hard and trying to breathe at the same time, or if we're trying to swallow at the same time. Then the third phase will be the esophageal phase. It's just the peristaltic wave of motion, the primary wave of peristalsis that continue to push food, bolus, towards the stomach. If the automatic nervous system is functioning properly, then food should continue towards the stomach. And the last phase is when the bolus enters the stomach and passes that lower esophageal sphincter, or also called or known as cardiac sphincter.